I'm going to speak on the topic neurological disorders. Neurological disorders is a broad term and includes a long list of subcategories or conditions, each with its unique presentation. What I'm going to speak to specifically is one of the more common underlying root causes to many of the chronic neurological health issues that patients struggle with on a day-to-day basis. To demonstrate my message, I am going to use an anatomical schematic diagram to illustrate how the spine and central nervous system is organized within our body. Your central nervous system is comprised of the brain, brainstem, spinal cord, and the 31 pairs of spinal nerve roots that exit the spinal cord. The skull protects the brain, and the spinal column protects the spinal cord. Between each vertebrae, there is a small opening for which the spinal nerve root is able to exit the spinal column. Once the nerve roots exit the spinal column, they begin to branch to form the vast peripheral nervous system, which connects the brain to every cell, organ, tissue in your body. Think of your brainstem as your body's central computer system, and through the wires of the nervous system, it is able to control and coordinate every function of your body. Your nervous system controls the way your heart pumps blood through the body, the way your lungs are able to breathe, your digestive system's ability to break down and absorb nutrients, reproductive cycles, go into the bathroom, movement, and even how a cut heals. If your spine and central nervous system is healthy, which includes being properly aligned, and there's nothing interfering or blocking the flow of vital nerve impulses throughout your nervous system, then your body should function properly. This is healthy and is the way it should be. However, throughout life, our spine and nervous system repeatedly sustains trauma. Examples include a fall off the monkey bars as a child, a fall off the balance beam, a fall off a horse, a tackle while playing sports, a collapse down a staircase, a slip on the ice, forceps delivery, car accidents, workplace injuries, to name just a few. Each of these traumas can potentially cause an injury to your nervous system, an injury called subluxation. A subluxation is a specific type of injury to the nervous system, which results in the blockage of the flow of vital nerve impulses throughout the body. A perfect analogy is water flowing through a garden hose and someone placing a heavy rock on that hose causing a blockage. Depending on what area of your nervous system has sustained trauma will determine the different types of health issues or symptoms you will experience. Now, before I get into the list of symptoms, it's important to understand the order of pathology. First is the trauma to the nervous system, the subluxation or cause. Secondly, whatever organ that part of the nervous system controls will begin to malfunction. Malfunction over time leads to a state of dis-ease. Dis-ease leads to conditions which eventually leads to symptoms. Symptoms are merely the effects, not the cause. Trauma sustained to the upper cervical brainstem area will cause things like headaches, tension headaches, migraines, lightheadedness, dizziness, vertigo, ringing in the ear, tinnitus, difficulty swallowing foods at the dinner table, changes in the pitch of your voice when you talk, and sinus issues. The base of the cervical spine, these nerves control the neck, shoulder, arms, right down to the tips of your fingers. Trauma sustained to this area of your spine will cause neck tension, tension behind your shoulders, weakness in your arms, especially when you go to lift heavy objects over your head, weakness in your grip. You may drop things or even notice tremors or shakiness in the muscles of your arm. And you may also experience numbness and tingling or pins and needles in your arms or fingertips. The next area is the thoracic area. This part of your nervous system controls your lungs, stomach, and heart. Trauma sustained to this area of your spine can cause chest tightness, shortness of breath, asthma, acid reflux, heartburn, and indigestion. The next area is the lumbar spine, the low back. These nerves control the internal organs of your body, the large and small intestine. Trauma sustained to this area of your spine will cause back pain, muscle spasms, but also gas, bloating, constipation, diarrhea, irritable bowel. The next area is the sacrum. The sacrum forms in part the sciatic nerve, which controls the bladder, reproductive organs, and legs. Trauma sustained to this area of the nervous system will cause problems associated with going to the bathroom, bladder problems, menstrual issues, menstrual cramps, hip pain, knee pain, foot pain, legs pain shooting down to the legs, cramping in your calves, especially when you lay in bed at night, and numbness and tingling, pins and needles, or even a burning sensation down into your legs and the bottom of your feet. And as these nerves control the core muscles of your pelvis, it can also lead to difficulty standing up, difficulty walking upstairs, bending, lifting, and walking, which is why people who have sustained trauma to their spine often need to resort to walkers and canes. In our office, we focus on the nervous system and spine for the cause of dis-ease. Our new patient examination includes a thorough and comprehensive assessment of your spine and central nervous system. The purpose of the exam is to determine the underlying root cause of your health issue, after which we put together a strategy or course of care designed to correct the issue. There is a big difference between treating symptoms and correcting the underlying root cause of dis-ease.